I showed up for COVID-19 long haul syndrome, yet I've never had it. So that was kind of how we put the pieces together and figured out that most likely this is vaccine induced, especially given their recent research on the topic.
Mhm. Hi everyone, welcome back to the channel. Now today we have our second patient interview, and I have here her name is Katelyn. Okay, she's going to share her personal story and experience after receiving the Pfizer mRNA vaccine. Okay, now I just want to emphasize again this video. The purpose is to bring awareness of side effects after vaccine, and we are not here to debate if the vaccine is good or bad, and we are pro-vaccine because we obviously have all gotten the vaccine here. All right, so without further talk, why don't we let Katelyn introduce herself and tell us a little bit about your story first.
Hi, thanks so much for having me on your channel. My name is Katelyn, as you mentioned. I'm 31 years old. I live in Minnesota in the US. I got the Pfizer vaccine May of 2021, and it's been quite a journey since then. So I'm happy to share information about that. And my hopes are to at least inform people of my experience who might be going through something similar, and hopefully kind of making this a more known topic to the world. So thank you very much for having me.
Okay, thank you. Katelyn, so you mentioned you get your Pfizer vaccine. Did you just got one or two, or did you complete the series?
So I got my first and only dose in May in 2021, and that the day after is when I really started to experience symptoms that began to concern me. So we can go into that if you'd like.
So what were their symptoms?
So there was kind of a change over time. Immediately after I got the injection in my shoulder, that's my right shoulder, I felt the shooting sensation go up my neck of like a tingling burning, and then it went away. So I didn't really think much of it at that point. The day after, the soreness was kind of radiating in my shoulder, which I was told was normal. And by the end of the day, the next day, I felt the pain crossing into my chest and actually pretty deep in my chest. And after a few days of that, it was really hard for me to walk without being exhausted. So my heart rate would go up. I was tired. I was breathing heavy. I would walk across my living room, which isn't very big, and I would get those symptoms. So it was concerning. At that point, myocarditis and pericarditis was not publicly known, or talked about rather. So I didn't know that it could be that at that point. So I made a doctor appointment instead of going to the emergency room like I should have. But by the time I got to the doctor, my symptoms already started resolving. And after explaining what happened, the doctor said, maybe it's just muscle pain. So from there, the pain kind of started migrating around. So I had a lot of pain in my shoulder, the right side of my chest, my neck, and the right side of my head. I also had pain in my abdomen. During that time, I started to feel exhaustion pretty easily generally, but not quite as bad as when I had that acute chest pain in the first week and a half of after a vaccine. So I went to the doctor a lot, trying to figure out why my symptoms aren't going away. But that kind of led to some testing. We had some imaging done. Nothing showed up, CAT scan, things like that of my abdomen and of my head eventually. Nothing was really visible. So we just kind of said, we'll wait it out. And then I had a few acute episodes of like really bad pain where I had trouble focusing. I was getting tunnel vision. I had numbness in my cheek for just a day. So it's just this really strong pain, burning feeling in my body in various places. Um, After that, so I went to the emergency room a couple times. During that time, it was actually pretty heavily full up with Delta. So I didn't go back with the doctor. They just did an EKG and said, your heart rate's slow, but not too slow. So we're not going to worry about you. So I was waiting for like 8 hours and I decided to go home because I thought maybe I could take some aspirin or something. So after that is when I started noticing that I was getting low grade fevers. I have two thermometers that I use to measure my temperature. So it's not just I feel hot, but like I was actually measuring. So I had like temperatures between 99.5 to 100.3 whenever I would get these fevers. Wasn't sure what they were. A lot of questions and not really a lot of answers. At this point, I started going to my doctor and saying, this started the day after I got vaccinated. Could that be related? And immediately she said no. So, okay, I figured she would know better. So this continued. Now my symptoms are exhaustion, especially after exercise. So I get flare ups. Exercise and stress events will trigger joint pain, headaches, fever, really bad brain fog. Like to the point where I'm not very salient. Like I can't have a conversation level. It's very strange. I get rashes, so my cheeks are always red now. I get a variety of symptoms. It's actually kind of hard to like list them all, but
so have you done any blood test or anything to in addition to imaging?
So December I went to the doctor a lot and a lot of questions and not really any answers. Then in December, I found a group called the Chronic COVID Treatment Center. They're kind of a conglomeration of medical scientists from around the United States. The Chronic COVID Treatment Center is a group that formed after COVID long haul became known, and they wanted to study it and treat it if they could. By mistake, they happened upon similarities between people who have vaccine related long haul syndrome is what they call it versus COVID-19 induced long haul syndrome. In my case, I did a lot of testing before and after I got the Pfizer vaccine. So I had 4 total antibody tests, 1 prior, a month prior, and 3 after. I also had a lot of COVID-19 tests because I was getting all these symptoms very frequently. All of them were negative. So by the time I got to the Chronic COVID Treatment Center, they ran a blood test called the Cytokine 14 panel. It's a laboratory formulated panel. It is not approved by the FDA. However, it is backed by there's some standards on laboratory testing and its utility. So they have that backing. So I did get that, and I showed up for COVID-19 long haul syndrome, yet I've never had it. So that was kind of how we put the pieces together and figured out that most likely this is vaccine induced, especially given their recent research on the topic.
Mm-hmm. Yes. So just trace back a little bit. Before the vaccine, before you got the vaccine, did you have any medical history? Were you on any medication, or was it mostly healthy or anything?
So I used to be a dog walker and I would walk 5 miles a day easily. every day. So that was my life. That was my job. I went hiking for fun. I love the outdoors. Minnesota's great for that. So we did a lot of activity prior. I was healthier. I gained weight since having this condition because exercising triggers flare-ups, and then I'm in bed for a week, and it's really hard to walk, and it's so severe that it's not really worth exercising quite as heavily as I used to. But yeah, I was very active, and my job made me active too. So not really any health concerns. Just like I had some knee pain in the past because there's a genetic predisposition in my family for that, but it was nothing like what it is now. I was able to walk normally after a long hike. Now it's hard to get across the room. I have to hold myself up. I'm actually in line to get a walker because I need assistance with that during flare-ups. So
Okay, so were you given any diagnosis of potential autoimmune disease or anything throughout your journey of medical appointments?
yeah, recently I actually saw a rheumatologist and I got a test for antinuclear antibodies. That came back positive. So yes, I have antibodies floating around attacking the nuclei of my cells. Does that mean it's directly linked to my condition? Well, it turns out having ANAs are fairly common, even in healthy people. So it's kind of a question mark right now, but at least we know that they're present. So it might be useful information in the future. The research that I've read from the group that diagnosed me, as well as I look at a bunch of research from multiple countries in the West and Asia, and some of these are pointing towards autoimmune-like disorders for some people who have this type of vaccine injury that I do. So.
Mm-hmm. Okay. So have you received any treatments, prescription drugs, or anything that seems to help, or is there anything that you took it was not helpful? Could you share a little bit?
Yeah. So for me, I practice lifestyle medicine now. It actually reduces the probability that I get a flare up with minor exercise, which is great. So that means I eat as fresh of foods as I can, lots of leafy greens, lots of foods that have anti-inflammatory properties, generally speaking. I don't eat sugar, I don't eat carbs, unless if it's a rare occasion. So I try to eat as healthy as possible. I also sleep at the same time every day for the same amount of time as much as I can. Sometimes I sleep a lot more because I get in a bad position where I need to sleep. I also go outside. I make sure I get enough vitamin D. That actually seems to be key in health, generally speaking, as well as immune health. I take some supplements. Most of them are known for their anti-inflammatory, cellular support, or immunoregulatory properties. So things like fish oil, NAC. I don't remember the word of it, but it's called NAC. Quercetin helps.
Yeah.
And a few other like minor things like that. I also take immune support supplements like vitamin C and zinc and copper just to kind of keep everything balanced. I also drink a lot of tea. That seems to help because tea can help with inflammation, especially green tea. Probiotics seem to help quite a bit as well. As far as pharmaceuticals go, the only thing that I've noticed, there's two things that I've noticed that help. So one is aspirin. There's something about aspirin and its interaction with the immune system. I'm not exactly sure what it is, but ibuprofen, for instance, does not work, but aspirin does. So there's that. And then oddly enough, the hot topic for some groups out there, ivermectin seems to help. It for me is not for treating COVID. It is for reducing inflammation in my body and regulating my immune system. It has an off-label tendency to help with those things. So that's what I take it for. I did try prednisone. I tried high-dose ivermectin along with prednisone. The prednisone did not seem to help at all. I actually appeared to get worse after I stopped prednisone.
Mm-hmm.
But ivermectin seems to help. So I take that a couple times a week.
Did you receive those treatment from your regular doctor or from the research group that you mentioned?
They do not prescribe. I'm glad you asked. So they will recommend treatment. Ivermectin is actually one of the medications they list as helpful because of its immunoregulatory effects and nothing else. So there's that. And they actually list a lot of medications, but they're kind of more of a consulting thing. They tell you what their research has shown. They write a letter to your primary care physician, and when you give it to them, hopefully they will take the advice of these medical researchers and go ahead with that plan. In my case, that did not happen. So I go to a local provider, so it's hard to find somebody willing to prescribe it for anything other than the typical uses, which are like tropical diseases or scabies in some cases, or facial creams, I guess, have ivermectin in them. So yeah, very hard to find, generally speaking. But there are a few people out there that are willing to help with that if you need it.
Okay. You mentioned some of those radiated, pain and all these. Have those all subsided now? What are the most bothering symptoms that you're currently experiencing? I know you mentioned some joints. Are there anything else that you want to share with us?
Yeah, so now I have pretty intense joint pain, stiffness, burning, lots of burning. I'm not sure why. I've never really felt that before, particularly after exercise. So if I'm walking a lot, I still get joint pain in my wrists and my elbows and my shoulders. It's pretty much as many joints on my limbs as possible have some either stiffness or pain. So it's actually hard to walk sometimes when I get to that level of flare up. I'm not really sure what to call it exactly, but that's what I call it for now. I also get rashes. So on my cheeks, on my chest, under my arm, on the right side, particularly. I'm not sure why, I got my shot in this shoulder. So can it be related precisely? Not exactly sure, but it's correlated at least. They're kind of like hives. So I'm not sure if this is like allergy-like. I know allergies tend to be immune system related, so there might be some sort of bridge there that I don't know about. I also get fevers, like I mentioned before. The brain fog is really something else. Can't have a conversation kind of situation. Need to just sleep. And tiredness. So I also get pretty sleepy for days, and I'll sleep 16 hours like I have a severe injury kind of sleep, where you're just really tired and uncontrollably falling asleep. I also, I did have a sleep study, so I sleep normally. It's just for some reason now I don't sleep very good. Those are the main symptoms, but sometimes I get like really random weird symptoms. Like one time I had veins in my leg that were like hardening and popping out of my leg. So I don't know. I've never had that before. I don't know if it's related, but just very odd stuff that can't really explain.
So, have you had any COVID in this period of time?
So I had COVID sometime between November 30th and June 2nd. The reason why I say that is because November 30th, my antibody test was negative, and June 2nd this year, my antibody test was positive. So months after my symptoms already showed up, did I definitely have COVID based on this antibody test? I have no idea when it occurred. I didn't really notice an acute infection. There was no cough, there's no loss of taste or smell. I realized that Omicron is generally milder, so that might be why. It could be a variety of reasons, kind of hard to tell. But I did get more tired and had a higher tendency of flare-ups during that time frame. So it was more like autoimmune-like symptoms. So I'm not really sure if it's from COVID. It also seemed to happen after I took prednisone, which did not help at all. It definitely, like, for a time after that, it was worse. So it's kind of a question mark there. We're not really sure what caused what, but I did have COVID at some point and my symptoms did get worse. So yeah, could be that.
Mm-hmm. So I've been taking notes of what you mentioned, and I was comparing notes, on next to me, and it's very interesting that several factors you mentioned, like the ANA and anti-nuclear antibodies, some of the symptoms like vein popping up, extremely tired after exercise, brain fog, those are all, it seems to be shared. It seems to be shared with other patients with similar vaccine side effect. So that's a common theme that so far has been occurring with the talk, with my talk with the patients. So is there anything you want that our audience want to hear that you want to share with us?
Yeah, there is an advocacy group for people who might be vaccine injured. They're called React 19, React-19. They are currently talking to the FDA and CDC. They have a variety of people who were definitely vaccine injured, people with really bad myocarditis or pericarditis, and then after that, developing heart issues like POTS, fainting spells, palpitation problems, people who were sporty before and now can barely go for a run or ride a bike without triggering an episode. So this is a group that I would encourage anybody who is wondering if they have these issues to just reach out to. I would also encourage them to reach out to the Chronic COVID Treatment Center. Bruce Patterson is the lead researcher in that group, and he seems to be really on the ball with the most up-to-date science regarding people who have vaccine injury and actually might be capable of diagnosing a lot more accurately than we previously thought. Vaccine injury versus COVID-19 induced long haul syndrome, which are very similar, it seems, in symptomology. So those are two places that I've been. They've been very helpful and very supportive. And there's a lot of help out there. You really got to stay diligent and push, talk to your doctors if you're not sure if it is the vaccine. An antinuclear antibody test might help just to start. So hopefully it works out for them. We're kind of in this together. So I hope everything goes well for them.
Okay. I'm very saddened by what you're experiencing, from this vaccine. And I really wish, time and or the medications or lifestyle medicines can help you, and your symptoms can resolve very soon. That's really my sincere wish. And thank you again very much for coming on to the channel and share your story with all of us. And like always, I will also provide a follow-up summary video looking into some of the shared symptoms between different patients and see if there's any literatures to back up and with some explanations to it. Okay, so that's all for today, and thank you very much for watching. And there will be more patient interview coming up. And if you want to share your story, leave me a comment, and I'll set up some interview with you. Thank you very much. Bye-bye.
Thank you. Bye.